So thank you so much, Beth. So for those of you who I haven't met, my name is Anna Brulette. It's really great to join you all this morning. I'm Building Bright Futures new policy and program director, and I'm really excited to support this co-group in the work that I'm doing in my new role, especially as it relates to the Act Early grant, as well as the Early Childhood Comprehensive Systems grant, universal grant that we're working on. So we'll certainly be talking about both quite a bit later, but just want to say hello and thank you so much for everyone joining this morning. I don't think that we'll do introductions individually, just take folks a while, given everyone in the virtual room with us today. So if everyone just wants to go ahead and in the chat, put your name and your role and where you sit, that would be wonderful. And I also just want to give a special welcome and thank you so much for the folks joining us today. Given the things on the agenda, which I sent out ahead of time, hopefully to everyone here, we really wanted to make sure to open up today's conversation to more folks from the CIS and early intervention community. So we have lots of additional new faces joining us today, and we're really excited to host everyone. So I just want to say thank you to those of you who have joined and typically don't sit at this table. We're really happy to have you. So we'll let folks go ahead and do those introductions. And Beth, if you have capacity to go ahead and do the screen share, that would be phenomenal. But if not, I'm happy to.
Yep, I can do it.
Great. Okay, thank you all for doing your introductions. So today we're really going to focus on the needs assessment for Act Early that we all participated in, or this group participated in last year. We reviewed the data from that at the time, but really want to return to it as we're thinking about the second year of Act Early, as well as really leveraging this group and our community and thinking about how we really set ourselves up for success with this really exciting 5-year opportunity through the HRSA grant as well as many of the other big picture things going on. This feels like a really great time to do those things. So given our work with Act Early, which we'll hear a lot more updates about shortly, we want to ensure that we're tracking and quantifying as part of our evaluation plan how COAT is doing in terms of serving as a table for our partners to learn about, share, and contribute resources and knowledge. So we're just going to launch a brief poll that we would love folks to fill out. For those of you who are not regular participants and don't regularly join us here at COAT, no worries. There's an option within the poll that you can select to indicate that. So no worries about interfering with the data. So I am just going to go ahead and launch that. And we'll give folks a moment to fill it out. Great, thank you all. We're getting good participation. Appreciate your responses. All right, I'm gonna give you one more second. All right, I will go ahead and end the poll if that's everyone, pretty much. Okay, I will share the results because why not be transparent? And our plan is to go ahead and do this again in several months towards the end of the Act Early second year period here towards August, just to make sure that we are doing our best in making this a productive space for everyone and doing all we can to really promote the sharing of knowledge and resources within this group and beyond this group with partners as well. So with that in mind, I'll stop sharing that. We wanted to do a qualitative poll as well, but Zoom does not allow for that. So instead, I'm going to ask a question, and if you feel comfortable typing a response in the chat, that would be wonderful. Otherwise, if you have ideas about this, we'd love to hear from you. So please feel free to email myself or anyone else on the BBF team. And we'd love to incorporate your feedback. So the question or prompt is, and I can put this in the chat as well, so folks remember, is what would improve the sharing of knowledge in and beyond code? So essentially, how can we improve? How can we move folks up on that scale that I just discussed? So folks want to chat in ideas, and there's the question. And again, if nothing comes to mind now, that's totally okay. But if you have thoughts afterwards, please absolutely feel free to share. I'll give folks another moment to think. I know it's early for this type of question, so totally understand. Great, thank you, Amy. All right, well, certainly feel free to keep thinking through that. And again, don't be shy about getting in touch if things come up for you afterwards. So now I'll briefly kind of walk through this agenda, and then we'll launch in, because we have certainly quite a bit to cover today together and want to make the most of our time as well in discussion. So first, we're just going to briefly kind of situate the conversation, talk a bit about the second year of Act Early, where we are, how it fits into the BCAP work as well. As I said, we're really going to return to this data that was part of Act Early's needs assessment last year and its findings and what it tells us about where we're headed. And then we're really going to launch into what feels most important for everyone here at the table today, which is this discussion and questions related to that needs assessment, and really kind of come together to talk about the current barriers and opportunities related to early identification and intervention in that whole system in Vermont. And then finally, we'll go to activities and updates. So Beth, if you want to go to the next slide and walk us through the BCAP material, that would be wonderful.
Awesome. Thanks, Anna. So you all know I'm one of the biggest fans of the Vermont Early Childhood Action Plan. You hear me talk about it a lot. And this is a plan that we all follow. This is not a BBF plan, but this is something that we have set out our long-term goals with specific indicators and objectives for where we would like to be in the next 5 years and beyond. And so within the VCAP, there are 4 goals. And the first one is all children have a healthy start. And this goal, for the way that we have built our kind of accountability structure, is that each goal has at least one committee that is stewarding the work and monitoring our progress. And so the Child Outcomes Accountability Team is celebrating our 1-year anniversary, I believe, where we established this committee to serve as the state leadership team for the Act Early grant and to steward Goal 1. So within Goal 1, we're really looking at children's healthy development, the environment in which they live, the health and well-being of their parents and caregivers. And so there are indicators to be able to measure progress along those pieces. I just want to share. So the Child Outcomes Accountability Team, I'm psyched to see so many folks on the call today and new people as well. We really seek to have a diverse group, which includes parents, people in health, and early childhood worlds, as well as we have, state agency people and those delivering services such as CIS and Head Start, and school programs as well. So we recognize that our work is stronger when we can build an integrated system, and that requires communication and long-term planning. And so the hope of this committee is that we are focusing on where we are identifying gaps and barriers, as well as being able to share best practices. And so that is a bit of the work of this committee. I have one more slide. This is a slide that demonstrates the levels of change for the action plan. So again, the action plan, the VCAP has 4 goals, and this depicts it in an ecological model. So we want to have a child and family centered system. And so each goal reflects the work to support each level of that system: the child, family, community, and community-based programs, and then the system. With goal 4 being Vermont's, the early childhood system will be integrated, well-resourced, and data informed. So that is the big picture at the system level. The other piece that I wanted to share is that, as Anna said, that the COAT team serves it. We have specific membership, though meetings are open, and we record the meetings intentionally. We know that not everyone can come to the table all at the same time. They'll welcome you to either tune in or watch the recordings. We can add you to the email list. And this committee serves as a state advisory team for Act Early Grant, which was awarded to Vermont from AUCD. And this team, we've really come to this team to provide guidance and strategy and decision making as we really look at our how we're supporting kids in their earliest years and as they navigate through our early childhood system. So thank you for being here. Anna?
Great. Thank you for providing that background, Beth. So if you want to go to the next slide, I'll talk briefly about year 2 of Act Early. And we are still a little bit in the planning phases and submitting our work plan and evaluation along with the VDH team in the coming days. But really excited about this opportunity to do a second year of this work and really continue to lean in to what the grant asks and really supporting that really reducing barriers between early identification and the delivery of services. And it was really very well aligned, as we've spoken to, with other grant work happening with HRSA in terms of this 5-year early childhood systems work. So last time, I believe it was shared that we have a second opportunity. I was not here, but it was shared that we have the second opportunity, and we have indeed been awarded that grant. And we're continuing to work through what exactly that work plan and those deliverables look like with the support of this group as well. So far in the second year, the plan is that BVF will continue to really leverage regional councils to serve as a space to promote and discuss early identification and intervention, family resilience, and really better coordinate and get the word out about these activities. As well as conducting an updated family engagement and leadership assessment, which is, again, really well coordinated with this other work happening. HRSA really encourages that as well through the early childhood comprehensive systems work. So there's a lot of exciting opportunities to really leverage families as leaders and support the work happening within our families and communities committee and kind of bring people together. And we're also thinking a lot about how to support other committees, including COAT, in really engaging with parents in meaningful and authentic ways. And how do we as a committee become a more welcoming space for them rather than the other way around? And of course, we're also continuing to advance a strategy to improve early identification, referral, and ultimately the receipt of actual services, which I think is where today's conversation really fits in with bringing all these experts into this virtual room. And then, of course, monitoring and evaluating our activities related to the grant. So we appreciate folks supporting that with just being part of today's poll. So that's a really quick overview. Happy to answer other questions about that as we kind of continue to flesh out what this year of Act Early work looks like for our team. So with that being said, I think I will continue and we'll get into re-reviewing the needs assessment data. So many of you have seen this, but for those that have not, this was conducted by the COAT team last year. And really, thank you for your question, Bev. Sorry for the all the acronyms. I'm still learning them myself, admittedly. So the VIP3 grant is the grant through HRSA that I was referring to. It's the Early Childhood Comprehensive Systems grant. And that grant really focuses on breaking down silos between the early childhood system and the maternal child health systems in Vermont. It's a 5-year opportunity, lots of family and parent engagement work, but also these other pieces around systems and policy work. Morgan, do you have an update about that?
Yeah, I just wanted to say that the chat is so incredibly rich right now and important. So keep all of that discussion going. And I'm thinking specifically about 2 things that I've seen here that relate to that HRSA grant that we call VIP3. Specifically, Pam's comment about a clear inventory of the early childhood system. That is something that we are in the process of building right now and we'll bring to this team for review, for additions, for thinking really critically about what the next steps are and pairing that not just with the inventory, but with a budget to say, here's what we know, here are all the partners, these are all the programs, here's who does what and what they prioritize. And how are they funded? Where are we having these gaps in the system? Where do we have duplication and how do we think critically about that? And then the second piece that I'm really clearly seeing come through are Floyd's comments around this outline of exactly what the HRSA grant is tackling and what the preschool development grant, at least in year 1, started to outline, which is what's the current status of this early childhood system based on needs assessments. What are the strengths? What are the barriers? What are the challenges? And how do we move to that next step? And that is something that as an entire BBF network, we tackle on a monthly basis, on a daily basis for most of us, right? Trying to identify those things. And then I think one of the challenges we face, as you heard before, is how do we communicate back to the network about each of those key pieces, because that is the role and the strength of bringing partners together to really dive into some of these pieces. So we're working on that, and I really appreciate the reflections here. And then Bev, to the other acronym, AUCD is the Association of University Centers on Disability. So those are our national partners really focused on how to support individuals with disabilities and special healthcare needs. And they are partially funding and supporting year 2 of this Act Early grant that we're talking about this morning.
Perfect. Thank you so much. And thank you to everyone contributing to the chat. It's great to see folks so engaged this early. So I'll continue. And for those, there's several people who just joined. So thank you for joining. And to back up a bit, these are, I'm jumping into now the period of this meeting where I'll briefly go over the needs assessment data from the Act Early Needs Assessment that was completed by this COAT team last year. But admittedly, there was about 13 or 14 folks who completed that survey. So certainly take all of this with a grain of salt. And that is really why we're excited to open up the conversation and to get more perspectives on this data. So at the very high level, partners identified a number of needs and strategies related to barriers in the early identification system, with a clear desire for alignment and better integration across efforts and strategies. There also, at the time, of course, this was completed during kind of the height of the pandemic. There was certainly issues identified regarding the workforce related to high turnover, limited capacity, and all of the implications that come along with those workforce challenges as well, such as wait times and concerns about effectiveness in terms of really serving children and families when they need support. There also kind of a theme arose around the need for a shared vision, language, and messaging when it comes to Vermont's early identification system. When it comes to Help Me Grow, what message are we sharing about the services that are available and what they collectively do? And then finally, this theme around limited data capacity in the systems to really support cross-sector work, make sure that we know how well the systems are doing, where the gaps are, and to really, how do we go from reducing how do we reduce barriers when we're not exactly sure what currently exists within the system? So along with that, we also identified current strengths in the system. So Beth, if you go along to the next slide. And great to see people think these still remain challenges, especially the workforce. As folks know, we highlighted workforce challenges during this week's SAC. So if you're interested, please feel free to check out that recording. So along with the challenges and barriers, we also know that Vermont's system has numerous strengths and many things that folks within this virtual room are really working hard to make work well. Particularly during the pandemic, it was clear from responses that folks really pivoted to focusing on basic needs and social conditions, recognizing that family health and mental health during this time really became the priority. And it's challenging to focus on other things when the constraints and environments in which families exist, those things really rose to the top, and that makes perfect sense. It was clear that there was a strength around the network of partners and stakeholders that are really referring to Help Me Grow and CIS. So many people got kind of a shout out in these responses: Let's Grow Kids, Head Start, BBF Regional Councils, 211, and many individual early childhood education programs referring to these services for families. And then additionally, the quality of services as well as the broad eligibility criteria are clear strengths in Vermont system and things that we wouldn't at all want to mess with or think about tweaking. Once families are receiving supports, it's clear that they're of high quality and that the broad eligibility criteria, it really makes it possible for families and young children to get the supports that they need. So pivoting along, there also, as I said, was a clear impact of the pandemic. Beth, if you want to jump along to the next slide. A clear impact of the pandemic when it comes to accessing early identification services. So folks who took the survey, responded to the survey, really noted that the capacity of providers to deliver virtual services, this was a whole new game for many folks in the system. We know that since there's been additional training for how exactly to provide telehealth services, and that's wonderful, but at the time it certainly was a challenge, and coaching and training for best practices related to providing those services was a need at the time. There also were these new roles for families in terms of navigating that virtual environment, taking on a more active role in their child receiving the services since they weren't sitting with a provider, as well as, of course, the need to access high-speed internet as well as an actual device, often to be able to connect to these services. Appreciate the additional comments. Yes, broadband access for sure. And then just providers relying on families, as I said, to implement these strategies and monitor progress in a new way was certainly a theme as well. And then, as I said, the challenges with the workforce, timeliness of screening and referrals, and different needs for families, with this shift often from focusing on child development to really ensuring that families' basic needs were being met during the pandemic. And then additionally, this issue of mental health, it appears that based on responses, there certainly was an increased provider focus on addressing family mental health challenges in order to better support and connect families to necessary services during that time, as well as some regional gaps and barriers in accessing those mental health services, especially during the pandemic. All right, so we also identified, we can go along to the next slide, Beth, a number of top emerging needs. And we're really curious during the discussion to hear from you all in terms of if these are still the top needs or priorities that you see. You know, it's been a number of months since this was completed and it was a fairly limited group. So we're excited to hear if these still feel salient or if there's others that come to mind. So again, really workforce capacity, particularly within CIS, you know, depending on the region, the need for more staff and support to really address current demand in a timely manner. This piece around workforce training and support, which we hear from a number of different sectors. And then this integration of different sectors, particularly it was mentioned in the survey, getting true buy-in from pediatricians or other early childhood professionals, early educators, to really make sure that those referrals are happening where they need to, and that everyone is aware of what services exist and what each of them is for. Additionally, this issue of sustainable braiding funding, like in many needs assessments that the team has completed, this kind of came up time and time again in terms of really needing sustainable and sufficient funding for the system, as well as this piece around the ease of reimbursement for services that are provided ultimately. And then the third bullet point here really addresses serving more children after that initial screening is completed. And that's really a true focus of Act Early. So we're curious to hear folks' thoughts on that and how exactly we address that need. And particularly how we address the needs of families and children who receive that initial screen but do not receive a service, perhaps because just of a lack of communication or some type of drop-off. And how do we capture those needs and stories? How do we capture, you know, what led a family to not ultimately receive a service? And how do we communicate and capture that? Because I think it's really powerful data, and the folks who completed the survey really suggested that would be interesting and helpful information to have. And we just don't know, we don't know the full picture there because of a lack of information. And then finally, certainly, particularly with the pandemic, this piece around access to technology and connectivity. So both broadband, like folks have mentioned, but also physical devices, access to telehealth services and supports, and then the workforce piece as well. So training and support for providers. Okay, so that was a really, really quick overview. Happy to dive into any of that further. I think I'll open the floor really briefly for questions about anything that I mentioned, and then we're going to go ahead and pivot to some framing from Morgan and dive into conversation. So if you have a question, please feel free to either unmute or enter it in the chat.
Thanks, Anna. This is Beverly, and obviously a topic that is near and dear to my heart. So glad to see that we're spending a meeting talking about it. Thank you so much. I think my head is kind of trying to wrap around the fact that this needs assessment is bigger than the topic of today, right? It's bigger than the early identification of services, but it's really around the system needs, right? And so I think I'm trying to wrap my head around those two things. And the bullet we're talking about integration of ECE and health providers under workforce capacity confused me a little bit. Are we talking about buy-in to the same system of early identification and screening and referral, or pediatrician buy-in to early care and education? I wasn't quite clear what that meant.
Sure, I can certainly address that last point, and then Morgan, if you want to do some more framing, I think you'll answer kind of a lot of those questions in your pivot to the discussion as well. Specifically, this last bullet, perhaps it doesn't belong under workforce capacity, Bev, so I appreciate that point. It might fit more under what I was saying around communication, about what broadly, like how are we communicating about what these respective services are for, how are we ensuring that health providers know who to refer to and are really bought into how strong Vermont's system is, and therefore feel really comfortable and confident referring a family that needs a service to the correct provider. And I think the same thing goes for early childhood educators. How do we ensure that we're communicating about how strong Vermont's system is, ensuring that they know the correct provider to refer to? I hope that answers or clarifies that point. Morgan,
Thanks.
do you want to address the broader question?
Yes, I can do that. I also just want to say, Bev, that part of that specific component in this needs assessment stems from all the work that your team in collaboration with the health department has been focused on in the last couple of years, really focusing on the pilots underlining early childhood and Medicaid, and really thinking about how we are engaging the right communities to make sure that we have this comprehensive system. So that actually is stemming from a lot of that work. Did you have a follow-up?
Thank you so much. I did, but now I'm like blushing. So I can I even remember what that was? I'm so grateful to hear that led to this. I think that one comment would be in general that we have this Help Me Grow Resource Center, and maybe the idea isn't that everybody needs to know all the resources and all the referrals, but rather to simplify the referrals so that there's maybe one place that people are calling. Just wondering about that as a general thought.
Thank you for teeing me up so nicely for the next piece of our discussion. And I'd love to pull down this slide share. I'm also realizing I have some feedback happening. But I'd love to see folks' faces for this next section of the discussion, and tell me if that noise is obnoxious, and I will take a minute to go address whatever that issue is in the background. Can you hear that, or is it okay?
No, I can't hear it.
All right, beautiful. Good job, Zoom. All right. So for the next piece of the discussion, we have done such a great job as a network in this past year of thinking about how to use data to inform our work, really highlighting that data. And so I want to provide a little bit of a bigger context for how we're thinking about the system that supports early identification, referral, and equitable access to services. And that is a much, I would love to say, a more manageable piece of the broader early childhood system, but it's actually not, right? It's one of the most complex pieces of what we need to be diving into as a state team in moving forward this body of work. So this morning, still, I'm ahead of myself. I really want folks to be thinking about this body of work as it relates to children's integrated services and Help Me Grow Vermont, both individually, but then how are these programs working together? And what is that logic model? What is the way that we've intentionally structured this system of service in the state of Vermont to support equitable access? And I'm going to walk you through 4 big components for some of the ways that we're thinking about this work to make sure, one, that everybody on this call knows about each of these initiatives, but also to give us that frame for the bigger picture. So what we just talked about was data from the ACT Early Grants Needs Assessment. So to Bev's first question, there was a focus on early identification, screening, referral, and then actually receiving early intervention services or special education services for priority populations. That was the focus of the needs assessment. But what we heard is that folks had so much feedback about how it relates and is situated in the broader system, right? So it's not 2 separate things. We have to be thinking more holistically. And I think that's great. The second component is the VIP3 project under the HRSA grant. So again, that one's focusing on aligning early childhood and maternal and child health and everything that comes with it, right? It's focusing on thinking about how we are talking about our financial resources and investment for these programs, aligning our strategy and language. Language is so important, right? How are we actually talking about our work across these different sectors? And how are we ultimately moving towards understanding the data that exists on these different sectors? And so this is also where Pam's earlier comment about that inventory fits. The first step for us is building a very robust inventory of all of the different groups, resources, supports, services, agencies that are prioritizing this body of work in the early childhood system. What is their role? What are the priorities within their role? What is the expertise? And then what funding is resourcing that work? Where do we have an opportunity to align that work? So I think those are the first 2 pieces. The next is me essentially asking you all to be vulnerable. And I'm going to call out a really big political tension that we have in our system right now, right? So we have this underlying political climate because of last year's bill that proposed to unbundle components of CIS and potentially be moving components of the Child Development Division to other departments or other agencies, right? There was that proposal and it didn't move, right? That didn't move forward, but it still contributed to the underlying tension I think that everybody is feeling in the system around the future of how we're supporting kids and families. Quick, raise a hand if that is what you are feeling in the system right now. Don't lie, right? This is what we're facing right now. And I want folks to be able to sit in that space, right? It's uncomfortable. It's not something that we are feeling great about. And we haven't actually tackled it or figured out how to move that forward. So I just wanted to call that out as a part of this conversation and thinking about how to move forward. Another component of this work is the bill that was in last session, originally H-171, but now Act 45. And within that, the bigger childcare bill, there was a specific component called the Vermont Child Care and Early Childhood Education Systems Analysis. So Building Bright Futures was tasked to identify a national contractor to come into the state of Vermont and do a really rigorous investigation of the governance and administration of how we support kids and families through childcare and early childhood education. Those are two very concrete, specific components, and we are very clear that those things are situated within a bigger system, and you can't talk about those two things without talking about all of these other components as well. So I'm raising that because as it relates to children's integrated services and Help Me Grow, that study will address this kind of bigger, broader, how is our system governed and how do our agencies and departments administer those programs? It's kind of that big, important vision about state government and capacity, but it doesn't actually address in all ways, we don't have the data to describe the impact of our programs and how do we build that arm? And I am seeing comments in the chat about what data exists in these different areas. And I think that's actually the next step in this discussion, right? So what we know to be true in our early childhood system and is outlined in our Vermont Early Childhood Action Plan is that as a state, up until this point, we have identified that Children's Integrated Services, the Child Development Division, and Help Me Grow in Vermont are in some ways seen as national best practice across the country, right? So other states are moving towards this idea of how do we integrate, how do we consolidate in the early childhood arena? And in Vermont, I think what's also important to very clearly identify is we all know the challenges associated with what happens currently in those systems, right? We know that we have a capacity challenge. We know that we have challenges with kind of our bureaucratic infrastructure. And we've identified on behalf of some of our providers, some of the administrative burden associated with these programs and what it means to have to collect data and, be continually updating the same forms across sectors. We also know there's financial cost associated with some of these programs, especially our programs that are focused on how we coordinate services, right? So all of us know, especially those of us in the room today, the importance of collaboration and how much time it takes for us to be developing the relationships with the people to make sure that we are collaborating, that we're coordinating our efforts. It's a critical component of all of those programs that we just talked about. And time is money, right? So all of the time that we're dedicating to this coordination effort is important. We recognize the value, but how do we figure out the funding components of it as well? So what we're proposing in this next year is that if we really want to figure out how to move our system forward as it relates to these steps of early identification and moving towards this integrated system that allows us to have this seamless transition and comprehensive system of support, we really need to understand the true impact of children's integrated services and how that impact is related to Help Me Grow Vermont in that framework. And so I want to also call out some tension between these two programs and allow us to sit in that for a minute, right? We know that these two programs were initially created intentionally as programs or initiatives or frameworks that were designed to work collaboratively together. Again, we know that there's some tension around how we do this work well. So I really want this group to be a primary catalyst for how we're breaking down silos around these narratives, right? These are not two programs in the state of Vermont that are competing for services. They are programs that were designed to work together and to be really intentional about how we move through these steps of early identification, referral, and getting kids access to services. And so part of the work this year is building that logic model, an actual visual, so that we in the state of Vermont can point to that and say, okay, yes, we understand there are challenges and barriers and where those gaps are, where there might be duplication, and we're going to get rid of those. But here's how these programs work together. And this is the original intent. And we have several partners on the call that can speak really passionately about that initial vision and intent and the plan to move that forward. So as we're moving into the discussion section, and we'll open the floor and facilitate that discussion, I want to this group to know that in this next year, we have funding through these grant opportunities that we've talked about earlier today to work very closely with the Child Development Division and especially Keith's team at CIS to be diving into the data that exists on CIS in the state of Vermont. So we'll be looking at qualitative and quantitative data, and doing in some ways a retrospective analysis of what we know and helping their teams to synthesize. So not just, increasing capacity for analysis, but how are we thinking about this data, synthesizing it and putting it into an accessible data brief that tells a big picture about this work in a digestible way. And this is something that's stemming back from, for those of you who are around the table, a couple of years ago where we held a state advisory council meeting and folks said, man, we have so much data on CIS. We really do have more data than we're talking about. And how do we, over the course of this next year, by July 2022, as the systems analysis is completed, also be able to say, this is what's working really well. Here are the barriers and challenges around children's integrated services, being able to map that to everything that's happening with Help Me Grow and other partners, not to say these are the only two pieces, but what else is happening around those two that will move us towards the vision that we have for Vermont's early childhood system. So again, just as a reminder, we really need to be using data and evidence to inform decision-making, right? And if we can't document the impact of our programs and talk about the critical components of it, we're not doing our job. So I want to pause to really say, I am really excited to partner with all of you on this effort. We're proud of the system that we've created, and now is the chance for us to actually understand how to move it forward, to build alignment across these programs and figure out what truly is working, where are barriers that we need to fix now and over the course of the next couple of years to support kids and families. So I'm going to turn it back over to Beth and Anna to facilitate discussion.
Great. Thank you, Morgan, for that framing. It looks like we might have a question from Cynthia. So I'll go ahead and let her ask that, and then we'll pivot to that discussion.
Thanks, Anna. And Morgan, I'm curious, with children's integrated services, I mean, it's a couple decades old now, and I do think it's an amazing system. It was incredibly innovative at the time, and it's fascinating that the nation is still looking to us. It has never been fully funded, to a lot of Pam's comments. This is one of these really great innovative system solutions that Vermont has not fully invested. So I'm curious, with that data, do we have an idea of what historically we thought it would take? And of course, this is going to change over the decades, right? But what we thought it would take to fully implement CIS to fidelity with what we were envisioning, and where we fell short and what it might take, knowing that the system should evolve, right? Knowing where we are now. But it's always interesting to me to look at our data when we know we haven't fully invested in the system that we built. So the data is always, to me, going to be a little wonky and not necessarily reflective of what the system could deliver had we fully invested in it at the time that we created it.
Cynthia, that is an incredible question. And it's something that we're trying to make sure that as we're diving into the systems analysis, so the bigger analysis, that we are bringing in folks that were around the table originally developing that system, right? Like, who are the original visionaries and who has that knowledge and data and expertise, whether it's institutional or folks that are currently in-house, that can say, this was the original vision. This was how much we identified it would cost. This is the logic model. Here were the strategic plans. This is how we are moving this system forward. But I think that in some ways, that's what we're really looking to dive into over the next 6 months. That was not great math, but that's what we're diving into. Is we know that across our early childhood system, especially in the needs assessment, not this one, but the other, the early childhood needs assessment of 2020, that in Vermont, we have collected so much data across a range of sectors that doesn't always give us the data we need. But we also know that every single one of our programs is underfunded, and that we as a state have started initiatives, have not necessarily at all times collected the data we needed to inform the impact to be able to fight for the funding that is necessary. And I think that that's an issue that we need to grapple with as a state, right? We want to be making investments in things that we know are so critical and working. And because we haven't documented in some ways the impact of all of these programs, we struggle to make that narrative, or at the very least, our legislators, our decision makers struggle to understand how much needs to be allocated and where. So I think that I think we have some work to do on all fronts, identifying this early childhood budget, all of the different systems of support, understanding the historical knowledge and the data around CIS to understand how we move it forward from where we are right now, right? Because we are at a critical moment in time because of the pandemic, but also because we're about to see some really important federal investment for kids and families across the country. We're not exactly sure what that's going to look like. We're really closely monitoring those trends and what to expect, and pushing all of our leaders across the state of Vermont to be thinking about that, while recognizing that our educators, our providers, our kids and families are still in crisis. And we're gonna struggle with that tension over this next year.
Great. Thank you both for that. I think it's a strong segue to really the type of conversation we're hoping to have here. And folks have been entering many thoughts and ideas surrounding this question into the chat. So I welcome you to raise your point to the group out loud. But the first thing we really wanted to bring to the table is, are the barriers and challenges that I briefly presented there from the needs assessment, do those still feel like the most pressing and relevant to you and your teams? Are there others that you'd like to bring to the floor and really ensure that we're thinking about when we're having this conversation? Like Cynthia said, certainly the issue of funding is one that perhaps we should, raise attention to, but really just welcome folks to think about that and unmute if they have thoughts.
And just to address a couple of the comments in the chat before we dive in, there's a lot of questions around data quality right now, right? Around the quality, what's collected, how it's informing decision-making. Are we asking the right questions? So the plan, and I'm looking at, Keith and Sheila and our partners at CDD, the plan is that the BVF is going to be supporting that team in saying, okay, what data do we have? Where do we see quality? And what questions can we not answer based on what's there right now? Is there additional information that we need to collect qualitatively from the field to give that full robust picture? So we are not saying, okay, we're just going to analyze what's there and hope for the best, right? We're actually trying to say we have an opportunity in the state of Vermont to do what's best for kids and families. What data, what information, qualitative and quantitative, should be used to inform decision-making moving forward? And how do we support our state in making that happen?
Hi, folks. I think
Brianna.
Morgan gave me permission to be one of the elders on this. You mentioned a few minutes ago that there was some intentionality in 2010 to how the health partners and MCH came together with the Child Development Division in the prevention space. So I thought I would just ground us, speaking of data, back in like the public health pyramid, which is 98% of Vermont's children have a well child visit in the first 2 weeks of their life, right? So let's remember pediatric healthcare at the base, the beginning, and, you know, without hyperbole, the best pediatric healthcare system in the country. Highest rate of well child care, highest coverage in our Medicaid program, covered at 312% of federal poverty. Only state in the country where all the pediatricians take Medicaid. There's no pediatricians that say, I'm going to do commercially insured families only. So I like to ground us there, and then I like to go up the next step, which is because of Let's Grow Kids leadership and a lot of good data analysis of workforce and need for childcare, 70% of families, of new families, have two people in the workforce, two parents. So that might be hyperbolic because people might have other care or, you know, do shift work to cover their own care of children. But just for the sake of it, we've got like 98% in the medical home, 70% in childcare. And then we start to head up, and you guys would be pretty astounded by how few, by the time you get into sort of like an early intervention system, how few Vermont families that is. So I want us to be disciplined to talk about all children and then head into their what happens in their homes, their medical home, and their child care or early care and learning environments. Then what happens if they find their way to children's integrated services, and then what happens if they happen to be in an early intervention program. So the only reason that matters to me is I think we stumble with representation along that way. And I will own this as a physician that we don't have adequate representation of pediatric healthcare in these conversations. And Morgan's worked very hard to get general pediatricians on the state advisory council. Ashley Miller is super committed, but I'm sure she's in and out and seeing patients. And so I'm happy to be here and to continue to frame goal one, because I do feel that there's a lot of great work going on in early childhood, a lot of great work at building bright futures, but the stake in the ground for this group has to be all babies, all children in this arena.
Thank you, Brina.
Pam, go ahead.
So as another old dog who was around at the inception of Children's Integrated Services, it's interesting, Brina, that you perceive it as CIS being for kids that had a higher level of need, because my recollection when we first began to talk about Children's Integrated Service was it wasn't just about the programs that eventually ended up being in that service set. It was a broader vision about prevention and early intervention and a seamless continuum that was connected, including with pediatric practices and kids having medical homes, right? So part of our thinking at the time, as I recall, was if we could do it well and design it well for kids that had special needs, and by that I mean it could be almost anything when you think about outcomes of social well-being, as well as typical disabilities or developmental concerns or even special health needs. If you could design it well for entry for all families and be thinking about, much as we're trying to do in other equity conversations, calling out those kids with disabilities and special health needs at the front end so that we were sure we were being inclusive, not adding them into a broader picture later. That was the idea. And I think, for a variety of reasons, we never fully realized it. We still have opportunities to deal with that down the line, I think. And as we're beginning to dive into assessing what we have now, what we want, and what we're willing to change in order to get there, I think it's really critical to think about this was all family driven from the outset. Families were saying things are silent. I don't know where to go. I have too many people coming into my home. We were trying to respond to that in a way that was not only efficient from an economic standpoint and a work standpoint, but truly effective, which gets back to what Floyd was saying about results accountability. How much did we do? How well did we do it? Are people better off? And how do we know? we haven't gotten there with our data collection. So I think it's going to be really important. And for those of us, and Margaret's a great standard bearer around this, Margaret Atkinson, in the Children's Integrated Services advocacy we've been doing to enhance resources for that service set. It's apples to oranges to pineapples to kiwis in terms of the data. And we're not even sure if we're collecting the data that truly reflects the impact of those supports and services for families, particularly if you get in early enough and you're able to do something at a lower level of intervention in a family. So I want to be mindful of how it all started and where we want to go now versus where we wanted to go then, and what we're really willing to do to get there, because we have a huge opportunity with this investment that BBF is making and our charge to really look at the system while we continue to advocate for better and more integrated services for young children and their families in particular, because the needs are greater now than they've ever been.
Yeah, thank you, Pam. Please don't misunderstand. I know what the intent was. I was just trying to ground us in, because it was so inadequately funded, it became the 4 core service, the only money was associated with home visit, nursing and family support, early childhood family mental health, early intervention, and specialized childcare. So and that is part of why, Morgan jumped us right into this really difficult time we find ourselves, where people are wondering about dismantling something that was actually, the original intent was groundbreaking. All states around the country have come to us to say, how on earth did you do that? And then, like all things, we have to tell the truth that it was beautifully designed on a whiteboard with Kim Kaiser. I can see the whiteboard. And then it never had the funding to be for all Vermont's families, which is why this is why the conflict with Help Me Grow is so strange but important, which is, if CIS was what it was designed to be in 06 or 08, I could see why our community pals think Help Me Grow is extra. But if you look at the numbers of people that find their way into Children's Integrated Services, there's depending on the community, 70 or 80% of Vermont's families that aren't touching that resource hub. So that's where Help Me Grow can gap fill or be a resource hub for others that can't find their way into CIS. So, and look at and Cheryl and Helen, you're going back even further. Yeah. So I'll stop there. It's such a hard thing to talk about, because I also want to start us fresh with people who are new to this conversation and put the family right in the center and wonder, rather than talk about how on earth we found ourselves with a bill to dismantle it. Like, it's just like, uh-oh. So I'll stop there.
Appreciate the historical perspective. Thank you, Pam and Brina. I wonder if we can
Can I say something?
Yeah, Sheila, just a minute.
Okay.
I would love to be able to take a moment to open it up for the CIS providers who have joined us. What your observation is in terms of what is needed at this point.
Do you mind if I just make a comment?
Yeah,
thank
go
you,
ahead.
Beth. And I do have to jump off in a moment, but Keith is still here. I think it's really important, at least from my perspective, to see the original design and to understand the original intent, because based on what I'm hearing, we're not anywhere near there. And a part of the analysis, I think, should or could reflect what was intended and where we are and why we are here, and then what needs to happen. Perhaps the original design is not applicable to today's world, but maybe with a few tweaks or a few changes, it would be. So for myself, I'd love to better understand the original design and how the whole system fits together, especially the pediatric medical home, starting in the beginning for all families and then working its way out from there. I'd love to see that in a visual, because maybe that is what we try to continue to work towards. You know, why, if it's not broken, if that design is not broken, why fix it? But if it needs a few tweaks, maybe we don't need to reinvent the wheel. So.
Thank you, Sheila. Kaya, I see you have your hand up. Would love to hear from you.
So the other piece, I think, to feed into this conversation, I haven't seen the original design, but from what I've heard, is as we're doing this, is to connect, if you're not, with the mental health integration work group that is looking at the integration of mental health and physical health services and how we do that throughout Vermont, because again, we don't want to be siloed. You know, if we're looking at these families and and I'm looking at it from a resilience lens, and working from strengths, then the best thing we could do is really make sure we're not parallel tracking resources.
Thank you, Kaya. Absolutely. And that is definitely the work that is ahead, that is prioritized in the year ahead. So, and have seen some of the reports coming out of that group. Other reflections from those we haven't heard from yet, especially are those providing CIS services. And I saw a note from Jen Fortman, who's the parent co-lead on the BIP grant. Appreciate, Jen, your comment. I also want to recognize the dynamics can be challenging, right? That this is an issue that we are passionate about, particularly being able to serve kids in the way that they need to be served, and that isn't always possible. We certainly saw people list barriers, including workforce being a major challenge, and the dynamics with agency partners and private partners being on the call. So thank you for kind of leaning into that dynamic. But this is a great opportunity to be able to share what you're seeing or what the challenges are in your ability to serve kids and families as we really look at how to improve the system.
Hey, this is Joe. Hi.
Oh,
Claire.
so weird.
Oh, yeah. Okay. We're co-directors in Washington County, and see,
That's great.
We think alike. So please,
Yep.
Claire, go ahead.
No, I'm listening a lot. I've been around the block a few times, as well as some of the other folks on this call. A little bit of deja vu all over again. And then you add into it a pandemic, and it's incredibly challenging. I feel like, the 30,000 foot level to like the 500 foot level, changing diapers all day, like almost every day. So systematically, this early childhood workforce challenge is one of, I think, the biggest challenges right now. And it's hard to put it in a box because it impacts everything. It impacts our ability to have parents back in the workforce. It impacts our ability to even apply for a special accommodations grant, because we know we will never find and hire someone to fill that. So there's a phenomenal amount of kind of ripple effects right now. And I don't think we can compartmentalize talking about the upstream services for young children without looking at the workforce challenges. It's definitely pandemic driven, but is it because of the pandemic? No, I mean, it's just what's broken the camel's back. And so I'm glad you brought that up, Beth. You gave space for people in the field and partners to kind of speak. This is all fantastic systems, heady stuff, and the balls cannot be dropped from this conversation. But the crosswalk to the reality in the field from programs large and small, and all of us are serving children on the continuum in terms of needs and abilities. and parents with needs and abilities. And right now, safety is probably my biggest priority, so the highest level of service is not the top priority on any given Sunday. And, I supervise EI as well. And, the staff are doing amazing work, but they see in childcare systems of, programs across the state that there's a significant workforce challenge. And it's definitely, in my mind, it's the number one thing, because if we can make some significant changes, and if this is historical times for financial investments and we think big, we could be having another conversation in 10 years, not the one we're having today. And so I just keep going to, how do we think bigger than we think we can think, and address some pretty significant barriers? And children will thrive if the adults can invest the money in the right places.
Thank you, Claire. Really appreciate that question. Joe, did you have anything to add?
Yeah, I wanted to speak on behalf of CIS, since we're talking about the system. I can't tell you how happy I am to have CIS in existence every day I come to work, because it's an intentional system that brings together community providers, state collaborators, and every day we do work with folks from FSD, from Reach Up, from CDD, around children and families, and the collaboration is just incredible. So to even conceive of the idea of dismantling a system and not having another system that would replace it is you shouldn't even think about it. And it's not, you can't think about funding. When you think about an integrated system, that's not the first thing that crosses my mind, even though my background is in finances. And it's like, this is about service, integrated service delivery. And as a region, Barrie does a great job of doing so. And then you sort of go, okay, so, and I know that we were talking about CIS being incomplete. When you look at the bundle, the umbrella of CIS services, look at EI and look at the work that Danielle House has done with EI in terms of the deliverables, in terms of the outcomes for children. And when I look at EI, I go, well, that's what's possible for every other service under the umbrella. And so there's still a lot to be developed, but it has so much potential. And folks know that in this region, we actually have a data system that could capture all the CIS services, that already does, that it's based on Salesforce, and that it works well. And it's a community system that we could sort of replicate across the state. So I can't speak enough about the work that gets done in this region around CIS.
Thanks, Joe. Others want to share both what you see as barriers, but also as we're shifting into a conversation where, I hear you, Claire. We want to be having a different conversation, right? And that's the point of bringing us here together today, is to be able to all take part in that. And so would love to hear both, if there's additional barriers we haven't heard from, but also how we can be promoting coordination, what is happening, what's working, so that we can benefit from our collective work together.
I'm going to add something, and I apologize, I missed the beginning of the presentation. But I think for me, having spent a substantial amount of time in AAA services, but also, in the early intervention world, I wonder about amplifying the messaging about these two organizations, because when you say CIS, we all in this room have this impression of all of the available services, right? We've all got different levels of depth of that understanding. But I think as we go forward in the conversation, a huge piece to me in working around now, currently Act 166 and EEE access, pediatricians know who to make a referral to and how to make a referral. And depending on kind of where their level of comfort is, and they choose which one whether they're going to make the referral to CIS or to Help Me Grow and have it funnel collaboratively to those directions. But I think part of whatever the improvement coordination plan discussion is also has to be, how do we get the message out to the families who aren't connected or who are connected and who aren't having these conversations in other ways, who aren't comfortable having the conversation with their childcare provider or with their current, provider through a CIS service, or who aren't comfortable having it as a pediatrician. I feel like families, and in this conversation about changing systems, the general public doesn't understand the broadness of the organizations and services that we're talking about.
Thank you, Becca. You saw my little celebration reaction go off, because one of the things that this next year is focused on is not just the data, but also the aligned narrative, right? And building the logic model and the visual and trying to understand what the best way to communicate is to the different layers of the system, right? How do we as a collective body, and this is something that the Early Childhood Interagency Coordinating Team is also talking about, ECICT, for those who are not as ingrained in the network, ECICT is the public partners or our agency leaders that serve on the State Advisory Council across the different sectors, coming together to say, how would we so clearly articulate and describe the work of each of these concrete programs that we as a state have said are so critical and are outlined in the VCAP? How do we talk about them? What are the kind of 5 bullets about each of them that we can consistently have as a narrative and visuals to support at the highest level our legislators and decision makers in understanding? But then what is that same narrative? What does it look like for families? What does it look like for providers? How do we have that aligned integration and kind of consistent language across the board that allows us to talk about this work? Really critical point to all of us, right? We can have all the data in the world. If we can't describe it in a way that's meaningful, we can't create change.
I almost think about like, if you could just recreate, if you could start all over again from scratch, and you think about somebody like the Google or whatever, the Silicon Valley, like if someone privatized the system and the child was literally at the center, if it was all child outcomes based, I don't know if we would be where we were today. I mean, it's all through, an adult's lens, and I just wonder if there was a complete redesign and money was not an object. I think we could create something that would be pretty impressive and that we could be pretty proud of. But, instead we're adding an addition or a room or a porch or a barn. And so I don't know what the answer is, other than I keep coming back to money, and the ability to be innovative and have children truly at the center, have it be a child outcomes based model. I feel like it's for some visionary thinking to take off. I think we have an opportunity this next year.
Thank you, Claire. It's so interesting to think about, because I truly believe that the OGs in the virtual room and originally did it in that exact way. They said, if we could do this well to support the needs of kids, this is what we would build. And we didn't reach that full potential, right? And we do have this kind of once in a century investment coming potentially from the feds across a range of sectors. And one of the questions that our systems analysis contractors are asking folks is that exact question. If funding were not an issue and you were actually going to try to do what was best for kids and families in the state of Vermont, what would that win be? Right? What would that win be for our system, for kids, for families? What would that look like? And so I think that that's an important thing to be thinking about. And how do we leverage what we have in place now and not recreate the wheel, right? We have incredible vision. We have incredible partners around the room who are providing services to kids and families. How do we build on that system while trying to reach that ultimate vision of how we are making sure that all children, each and every child, has a healthy start?
And footnote, I had no idea what OG meant until a few weeks ago. My daughter's friend had to school me, so I now know what that means.
I don't know what it means, Claire. I was just gonna ask.
Original gangster. It's like the historical first people that were cool.
Is that politically correct to call out gangsters as like a?
Probably not, Brina.
I did want to just say that classic admiring the past as though it was like the halcyon days of the World War. There was a ton of loss in public health when CIS was created, because the early intervention and at least nurse home visiting was taken out of public health and put into the child development division. So I don't want to describe this as some love fest. And that loss has still a taste on the health side that it was taken out, measurement stopped, and this is hyperbolic, but there was less attention to measurement in 2008 in child development division than there was in a public health system. So please don't, I don't want to glamorize it. And I do think there's something here about a deeper, and people have been saying this in the chat, this is like the richest chat in the history of Zoom. What do we need to do to just describe each other's work so that there's not this feeling of like, what's the best place for a family? Right? Like Floyd and I are great old pals, so I'm going to accept it, but the friendliest and warmest, most welcoming doors may be the PCCs, it's true, but they're I just want to make sure we're not trying to describe a hierarchy of care or kindness or attention or impact. You know what I'm saying? Like, we're all at risk for this. You've all known me long enough to know I fade into it at times. So I just want to call that out.
Go ahead, Pam. Thanks, Brina.
I really want to acknowledge that, Brina, because you're right. At the time that those programs were, quote, pulled out from the Department of Health and put together in the Child Development Division, there was also a hope that we were integrating in the Agency of Human Services transformation such that across departments and divisions, we would be drawing upon strengths even if they weren't sitting in a department necessarily. It was really trying to focus on that age range and those types of early intervention and prevention services. And at that time, it was a bold move. It really was. And we haven't seen it through to fruition. And what I'm wondering about as we're thinking about this, to your point, yes, know your past and your history and what the intention was, but don't be afraid to dream bigger and better and in the context of today's world and today's families, because this always was meant to be about better services and better integrated services for young children and their families. And it wasn't supposed to be about programs, and it wasn't supposed to be about organizations, even though ultimately all of us have, our stake in this, whether it's organizationally or individually. But if we could leave our organizational hats at the table as we get this new information in this assessment and really be clear about what is it we want to accomplish in the state of Vermont for young children and their families, and what are we willing to give up of our ownership of particular things, that would truly be bold, back to Claire's point. And I don't know if we're ready to do that. I really hope we will be. I mean, I'm a Pollyanna and always have been in my career here in Vermont. And I'm still very hopeful that we will achieve something bigger and better and more integrated and certainly accessible and understood, not only by providers who would funnel kids and families into that system, but the families themselves would know what it was and how to get to it. And anybody who was around at the time, no wrong door was the big theme back then. And it could be whether you were excited about the Parent-Child Center being the warm and welcoming place, or your pediatric practice, or Vermont Family Network or Winston Prouty Center or wherever it was, you would be able to know that when you went in there, you would get the resources you needed according to what your concerns were walking in the door. And if you didn't know what you needed, that they would help you figure that out.
Thank you, Pam. Kaya, you have your hand up. Would love to hear from you.
So I'm going to build on something Pam was saying, actually, that really made my ears perk up and think, is as much as the past 18 months has been one of the biggest challenges of my career and everyone's careers, I think we've learned a lot about service delivery and alternatives. So we may really be at a good spot to pull out that original work, but dream bigger with what we know today. So I think that's an important thing to remember too, is that was done back in the early aughts or mid-aughts, and we're now at 2021. What's changed? How, what have we grown? What do we know? So I agree is we don't want to enshrine the past. I think as a group, we want to take that past and say, okay, if we tore it all up and use this as a bedrock, what could we do now with the resources that we know work or don't work?
Thank you. So we have what a rich discussion, both verbally, but also in the chat, and we are trying to capture it in notes as well. We are coming up on time and just want to invite people to come back to this table because we want to continue this discussion. We have incredible opportunities over the next couple of months and to be able to utilize the incredible institutional knowledge that is here at this virtual table. And so hope that and invite you to continue to lean in. And if this format is not the place where you feel comfortable sharing a follow-up email to Anna or myself or Morgan is very much invited. There's a range of opportunities for us to continue to kind of retrospectively look at data, as well as engage in what information has already been shared so that we do kind of adjust our path going forward, right? So as we are at the end of time, again, there are also a number of opportunities with this VIP grant that we talked about to engage pediatricians at this table to do this. Certainly there's the systems analysis as well as an inventory of services, just to name a few. So want to thank you for leaning in. I'm going to ask for people to make updates in the chat as we kind of have our last reflections. Cynthia, I see have your hand up.
Thanks, Beth. And then you just asked for them in the chat, so I can do either. Let me do it very quickly. I just, as a potential opportunity for data, slightly aside from what we've been discussing today, but certainly tied into families' basic needs. We were just offered a Nemours Springboard opportunity, which is a geographic information mapping around CACFP, where food deserts are, where there are rates of food insecurity. And so that work will be happening through the Farm to Early Childhood Coalition between now and June or July of next year. And so we'd love to share that data with this group and any other groups in the assessment piece, thinking about nutrition security for families.
Thanks, Cynthia. Any other updates or announcements? I'm putting one in the chat.
Beverly, I'm seeing your question in the chat around the role of this group. And this is the state team that's dedicated to monitoring goal 1 of the VCAP. All children have a healthy start, right? So this is the group that will continue this discussion, and we want to be building this team's capacity in terms of the right people and voices at the table. So we will be continuing this discussion here, and bringing the work of that VIP3 grant, this early childhood mental and maternal and child health systems integration grant, all of the work that we're going to be moving towards under that grant will be brought to this table as one key point of centralizing across our system of experts.
And also to say that the November, typically the Child Outcomes Accountability Team meets the 4th Thursday in November. We're moving that up a week because of Thanksgiving, and would invite folks, if you want to be added to the email list. We would love to have you around the table. I'm just going to put the charge for the team is on the agenda, but we'll also put it in the chat. Anna, did you have anything else you wanted to add as we finish up here?
No, I think this is great. We really appreciate everyone's time today. It looks like folks found it to be a valuable discussion, and really appreciate all the engagement in the chat and otherwise. And please feel free to be in touch about, again, that beginning poll question. If you have any feedback or ideas about future topics for us to delve into more, we're all ears, or other ways we can really promote the sharing of resources. We'd love to hear them. Great. Well, thank you.